The vitamin D conspiracy is a term that some individuals use to describe their belief that information about the health benefits of vitamin D is being deliberately suppressed or manipulated. Proponents of this conspiracy theory argue that governments, health organizations, and pharmaceutical companies are either downplaying the benefits of vitamin D or pushing misinformation for various reasons, often financial. Here's a breakdown of the elements of this conspiracy theory. Claims of suppression or downplaying. Health benefits of vitamin D. Supporters of the conspiracy believe that vitamin D has a wide range of health benefits beyond what is commonly recognized, including preventing diseases such as cancer, heart disease, and even certain mental health conditions. They claim that these benefits are being downplayed to keep people dependent on pharmaceutical products. Alternative to pharmaceuticals. According to this theory, if more people were aware of vitamin D's benefits, they might rely less on pharmaceutical drugs for chronic conditions. This, in turn, would hurt the profits of pharmaceutical companies, which allegedly have a financial interest in maintaining the status quo. Economic motives. Pharmaceutical industry. A key aspect of the conspiracy is the idea that pharmaceutical companies would lose money if people took simple, inexpensive supplements like vitamin D instead of more expensive medications. The theory suggests that there is a deliberate effort to undermine the credibility of vitamin D to protect these profits. Healthcare costs. Some also argue that the healthcare industry as a whole, including insurance companies and healthcare providers, profits from treating chronic diseases that could be prevented with adequate vitamin D intake. They suggest there is a financial incentive to keep people sick rather than promote simple preventive measures like vitamin D supplementation. Scientific manipulation. Research bias. Proponents of the conspiracy theory argue that research on vitamin D is biased. They believe that studies which show limited benefits or even potential risks of high vitamin D intake are funded by entities that have a vested interest in undermining vitamin D's reputation. Withholding information. Some conspiracy theorists claim that positive studies on vitamin D are either not published or are buried, while negative studies are promoted to create public skepticism about the benefits of vitamin D. Government and regulatory agency involvement. Regulatory standards. The conspiracy theory often includes claims that government agencies, such as the FDA in the United States or similar bodies worldwide, set the recommended daily allowances, RDAs, for vitamin D far too low, intentionally underestimating how much is needed for optimal health. Public health recommendations. Conspiracy theorists argue that public health recommendations are intentionally conservative about vitamin D, advising levels that are just enough to prevent acute deficiencies like rickets, but not enough to realize its full health potential. Public skepticism and disinformation. Misinformation campaigns. Some believe there is a deliberate effort to spread misinformation about the potential dangers of vitamin D supplementation, such as toxicity concerns, to deter people from using it. Censorship. There are claims that those who promote the idea that vitamin D is more beneficial than acknowledged are censored or discredited by mainstream media and medical establishments. Response from the medical community. Mainstream view. The medical community generally does not support the conspiracy theory and points out that there is substantial evidence-based guidance on vitamin D. Most experts agree that vitamin D is important for bone health, and there is some evidence for other health benefits, but the consensus is that more research is needed to confirm some of the broader claims. Safety concerns. Medical professionals also highlight that while vitamin D is essential, excessive supplementation can lead to toxicity, with potential side effects like hypercalcemia, high levels of calcium in the blood, which can be dangerous. Public reception and influence. The vitamin D conspiracy theory has gained traction in certain circles, particularly among those who are skeptical of mainstream medicine, proponents of alternative health practices, and some wellness communities. This theory has led some individuals to self-prescribe high doses of vitamin D, often far above recommended levels, which could pose health risks. The vitamin D conspiracy is a complex mix of skepticism about the pharmaceutical industry, distrust in government and regulatory agencies, and a belief in the suppression of alternative health information. While vitamin D is indeed essential for health, the majority of the scientific and medical community does not support the idea that there is a concerted effort to suppress its benefits. Instead, the mainstream view is that while vitamin D has known health benefits, claims beyond those that are well supported by evidence require further research.